According to the National Safety Council and medical research, 20% of backaches are attributed to inflammation such as arthritis. 10% are due to actual back injuries and other miscellaneous causes. 70% result from degeneration of spinal discs. That's right, aging of the spinal disc material causes the most trouble and can cause extreme pain even from routine body motions. You've all heard the routine warnings about bending your knees and lifting with your legs. We see people lifting boxes to demonstrate the proper technique. Those techniques are still correct, but we don't always pick up a box, or the item we want to lift is sitting under a storage rack or other difficult position. Today, we want to explain how the back works so you'll have enough information to make the right choices on how to lift anything safely. We'll also discuss how strains and muscles work so you can prevent these types of back injuries also. There's no magic formula. All you need is a good attitude about safety and are willing to think about safety every time you lift anything. If you'll do that, it's difficult to have an injury. First, let's talk about the mechanics of the back. Each disc is a circular pad filled with gelatinous substance under pressure. The disc looks like a soft hockey puck with jelly on the inside. The disc works like shock absorbers or springs that provide a linkage to the vertebrae or bones, but prevents any sliding of one vertebra against another. The spinal cord is a bundle of nerves in a protected vertical passage behind the disc area. Nerve roots branch out through spaces between each vertebra and go to different parts of the body. The normal range of spinal movement is shown here, while bending forward and backward. You can see the nerve roots are in a vulnerable position because the spinal cord must bend and flex without the vertebrae slipping out of alignment. It is quite easy to wear out a disc with normal movement. As you bend and move, your discs are working, just like the shock absorbers in your automobile. Discs can become damaged through excessive twisting, turning, bending, and when this happens, the disc may spring a slow leak. Now, as the fluid leaks out, you can lose disc pressure. This loss of pressure in one disc can affect the entire linkage. It can happen at almost any age. You don't have to be old to wear out your disc. Back pain sufferers should pay constant attention to posture, standing, sitting, working, even while sleeping. The lumbar flexion or dynamic posture as shown here helps widen the opening that nerve roots pass through and reduce the chance of pinches. Regular exercise is encouraged, which promotes flexibility of the muscles and all the other body parts to keep you healthy. Okay, let's talk about those muscle strains. Actually, when you stretch, ligaments in your back stretch also. Now, if you stretch too far, these ligaments may tear or overstretch. They can be quite painful. Many times we must lift something over our head, so you're going to stretch your arms to reach the object. The best way would be to set the lifted object on a table or other support. Then reposition the object so your arms are doing the lifting, not your back. As a minimum, reposition your grip on the object to keep the weight centered. Arching the back during a lift makes nerve roots susceptible to pinching. Just remember how the discs protect the back and try to make the lift with your back as straight or in a normal position as possible. When you do this, the discs can do their job without damage and the ligaments aren't stretched so far that they'll tear. Naturally, medical research has provided us with some basics about your back to help you understand how the back works. The back works like any other machine on the lever principle. You have a load and a counter load. The load you're lifting and your back balanced on a pivot point or center of gravity. The heavier the load, the more counterweight you need, or some position to help offset that load. The back has a 10-to-1 ratio to the object you're lifting. If an object you're lifting weighs 10 pounds, it's going to take 100 pounds of pressure in your back to lift the object. This puts a lot of pressure on those delicate discs. Add in more weight, more length of the lever, or an awkward position, then you're adding much more pressure on those discs and, of course, the ligaments. That's why you hear safety and medical personnel telling everyone to bend your legs and squat down near the object you're going to lift. This keeps the discs lined correctly between the bones. Get a good palm grip. Don't use your fingertips. The palm grip is designed to make sure the object you're lifting doesn't slip out of your hands. Lift the object slowly to prevent any jerking movements that can cause discs to move out of their proper alignment, and bring the object close to your body. This reduces the lifting pressure based upon the 10-to-1 ratio of the lever. The closer the load, the less pressure it takes to lift. You have a good grip. The object is close to your body. Now stand up. You're using your leg power to do the lifting, not your back. That's the standard method of lifting safely, and it does work. Now, how about the more difficult lifting situations, such as trying to lift different types of objects in a less than ideal situation? Let's take a look. Did you notice how he used his free hand to provide support for some of the lifting? Anything you can use to provide additional support is great for your back. How about trying to install a car battery into an automobile? You have to be standing to get the battery over the fender and into the battery case. Can't bend your legs on this one. The next best thing to do is move your legs against the car's fender. This provides good support and assistance to your back when the battery is lowered into the case. Use your legs whenever you can to help reduce the load or pressure on your back. Keep in mind how your discs support your back, the 10-to-1 lever ratio, and that you have ligaments in your back that can stretch and possibly tear. Whenever you have a particularly difficult load to lift, you can use your good judgment and make the right decision how to lift properly. Naturally, if the load is too awkward or heavy for one person, get some help. Safe lifting doesn't have to be perfect, but it does have to be done safely. Twisting your back while lifting is extremely dangerous. Find another way to lift, because it only takes one wrong way to cause a problem. Perhaps you have been lifting improperly, twisting and lifting and stretching, and your back is still in good condition. Well, that doesn't mean you haven't injured your discs. Perhaps it just means that time, age, and body mechanics just haven't caught up with you yet. Maybe it means you're healthy and just one of those persons that will never get sick or experience an injury. Well, you're fortunate. But we urge each individual to practice safe lifting all the time, at home, play, and at work. Back injuries can be prevented, but you're the only person who has control over your well-being. The most important part of safe lifting, actually any type of job and home safety, is having the right attitude about safety and thinking about safety before you perform each task. Take time for safety because it's important to you, your family, and your job. Thank you.